So Ryan,
Hey,
you made it.
I did.
You made it. Nice. Making me sweat a little bit. I've
I
been
know. I know.
getting ready to tell some dad jokes, but I'm sure that would have kept people's attention for 3 or 4 seconds. All right, Lindsay, you got everyone joining us now. Let's give everybody a couple minutes. I know we're
You
running a little
should
late.
tell this. You should tell the story in the webinar about how I schooled your high school or like your son's basketball team, foot
Oh,
or
that's right. Yeah,
his baseball. Anyway,
you won
I
the
ran your
football
high
the
school
football
team.
pool.
So yeah,
All right, I'll tell that story. We'll get another one. So
it's actually pretty funny.
And if anybody wants in on these fundraisers, just put it
Yeah.
in chat that you're willing to support the local Ridgefield
Right.
basketball
Yeah.
and baseball teams. But the Ryan had made the mistake of texting me a question like the same day that this fundraiser thing went out. I was like, you know what? Big Wig out of DC could play this game. So it was the college football playoffs, I think.
I want to get him on a
And
money on that. So
there was a whole bunch of it was like a whole bunch of side bets going on. And anyway, it's like all these families in Southwest Washington were in it. It's a big fundraiser thing, and the guy out of DC comes in and wins the whole thing. So
because I wasn't a
Ryan worked
Washington
as
fan,
the
that's why.
was the winner. Yeah, exactly. Nice work. All right, so 3 minutes past the hour. Let's get this show rolling. So Ryan missed the memo on Fireside Chat. He's doing office building, you know, blinds chat. So forgive him for
Right.
that. But he
Sorry.
did just come running in. He just came running in from the White House. So that's kind of cool. I mean,
Yeah.
he just literally came flying in, and I don't know what you're doing there, probably solving world peace. But other than that, we can get this going. So Lindsay, why don't you go to the introductions? There we go. So Ryan Work has been a guest on the Fireside Chat series. I don't know, you're kind of like the SNL guy that's hit the annual the
Right.
annual invite. Always been a pleasure. Sadly, which will be an announcement later. I don't know if it'll be his last or not, but we're going to enjoy this one for sure.
Yeah.
And we're going to be going through kind of all the things current on what's going on with the self-funded world, the politics and the impact on it. And we're going to kind of do we've always had a casual way of doing the fireside chat, but this one's even going to take it to the next step. So we're not going to be doing slides today. I think you've got a board meeting later today. Was that what was going on?
Next week. Next week is my
Next
first.
week.
Yeah, yeah.
Oh,
So
so you're just overly prepared. You're overly
it's,
preparing for your next board
it's
meeting.
really good
Okay.
timing, Heath. Yeah,
You just
yeah.
didn't want to make me slides. I think that's what it was. But anyways, Ryan's going to be giving an update here. Always entertaining, always informational. For those of you that have not attended one of these in the past, if you look at your Zoom browser, there's a chat button. Feel free to leave comments there. But if you got questions, please put them in the Q&A section. There's a little button down there that says Q&A. Then I will read those off as we go through. Ryan always gets a lot of questions, so I'm excited to see what people are looking to learn more about. And with that, I'll turn it over to Mr. Work. Thanks for being here.
Yeah, no, thanks for having me. I mean, you know, I guess, first off is just kind of the political overview of what's going on in Washington. I just got back from the White House. It's I hate to say it. I always like, oh, remember like when things on the Hill were working well, like back in the day, and I feel really old about myself. But it's truly dysfunctional and not in a good way. I think we're, in terms of the healthcare front, Heath, we're there's many moving parts right now, from PBMs to drug pricing to price transparency, and I think there's a bipartisan effort to get things done. But because of the dysfunctionality going on in the chambers, I think that even the bipartisan approach to making good policy is kind of broken down, right? And I think I had an expectation, at least earlier this year, that we would see PBM reform, we would see some sort of drug pricing, we would probably see higher standards around price transparency, and that's kind of out the window because the fact is that when you have when you have fistfights in the Republican conference, you actually can't, surprise, surprise, you can't get things done. And I think for that reason, we're just seeing like a total standstill to a point where we're not even, getting budgets done. And obviously, this week they finally passed Ukraine funding, Israel funding after what, like a 5 month stalemate. But what that's done is kick the can down the road on a number of other important issues, like we're seeing on healthcare. And it's also an election year. And so, I think folks on the Hill are looking at they're already looking at November. They're ready to go home. And if I put my like a crystal ball in front of me about the upcoming political season, if you will, I think the House is going to come down to 4 or 5 seats one way or another. Do I think Speaker Johnson has a job in a couple of months? Probably not. From a lobbying perspective, we know a lot of members of Congress. I'll be honest with you, I've never talked to Johnson in my entire life. And I can talk to 20 other friends who are lobbyists, and none of them have either. And so it's kind of an unknown entity, but it's kind of a function of where House leadership is at, where there's not much leadership. It's kind of just going, because you have a 1 vote margin for kicking off, the speaker. It creates chaos, and chaos doesn't lend itself to actually a productive political environment. Heath, I'll ask you a question. Do you have any idea how? So if I asked you how much do you think campaigns will spend this year on political advertising, what would you tell me? On TV. I'm putting you. I'm putting you in
I
a
have
tough spot.
no idea. I mean, probably a heck of a lot more than is needed to pass some bonds in local school districts and things where money could really be spent well. But
well, I think I say this a lot. I think we're all in the wrong industry, because this year we're going to break a 10 billion record, and they're thinking that we'll see $15.2 billion in TV advertising for campaigns, which is a pretty big number. And so like I wouldn't want to own a TV station, but I'd like to own a TV station during about 4 months out of every election year. So it's
one thing
I've
always found funny
your head around.
flying around this country for business trips is just the amount of difference between, like, if you're out on the West Coast, for example, Southwest Washington, and the lack of campaigning you see here versus sitting in Ohio. It's like nonstop. So I've always found that.
Well, and you have mail-in ballots there, but it's so I mean we're Congress is ready to get out of town. They're not. I don't think they're in a serious position, especially after this past week with the funding, to actually do much more productivity. I mean, they have a couple of things that they have to do. Whether they do those, I'm not sure, but basically it's open campaign season. And so folks are ready to go home. They're ready to campaign. It's a very serious election year. We'll probably see flips in the House and Senate, but at the end of the day, it comes down to about 7 states. It comes down to places like Pennsylvania, which I wouldn't have said, that maybe a couple of years ago. Places like Michigan, Arizona, Nevada, especially when it comes to the Senate. And obviously Joe Manchin out of West Virginia is retiring. West Virginia is a red state, and that one single state is going to have an impact right on the Senate when the Senate majority is just a single seat, right? So I think the impacts that we'll see are going to be big. I don't think the House and Senate are going to have big margins. I mean, we're down to literally between 1 and 3, 4 seats in either chamber. And the reason I tell you all that is because it's important for healthcare policy moving forward, right? I think we're at a point where, and I'll talk about this more, but that ERISA is under attack. We're talking more about the cost. The more the cost of healthcare goes up, the more that there's talk about a nationwide public health system. we're talking about high drug prices, and a lot of us are having conversations about things like Ozempic, right? Which is creating a stir in the marketplace. We're talking about cell and gene therapy drugs and just the cost of care. And we're also facing, I think, a number of issues around price transparency. So we have more data available. Should we get a lot more data? Absolutely. Are we getting it appropriately? No. And that's a battle I think the industry is going to see for years to come. In addition to the fact that we have these kind of new and emerging drugs that are not only challenging to us, but are challenging to providers and patients in terms of the amount that it's costing us. I'll also say this. I mean, this is one of the things I think we need to celebrate, by the way, and not, so like I'll push like the monstrosity of politics aside, is the fact that this is the 50th anniversary of ERISA this year. And we should celebrate that, and we should embrace it. And especially from a self-insured standpoint, that ERISA preemption is the mainstay of what we do as an industry, at least in the self-insured side. And we need to do a better job of telling why that's important, because we don't talk about it enough, and people, I think, take it for granted. Last week, the House and Labor Committee had a hearing on ERISA. The fact that they had to have a hearing is I think we should be concerned about it. That members of Congress need a study on ERISA. I think that ERISA preemption is not very well understood from a congressional standpoint, and that's worrisome, because if I've said this in a number of ways, but our worst enemy are members of Congress who don't know about the policy that they're doing. And if they don't know about ERISA and the preemption issues that are going on around there, and the fact that ERISA is the primary driver of the ability to self-insure, then we're all in big trouble. And there's a real challenging conversation going on the Hill right now about the future of ERISA and whether that's even needed. And I think there are a number of states, especially state insurance regulators, who are pushing back on ERISA because they want more control over that. And I think it's a challenge moving forward. So,
What do you think the biggest driver of wanting that control? I mean, is it simply a control desire, or is there an agenda behind it?
it's a funding agenda, Heath. I think the agenda behind it is getting more state revenue, because they want to tax, the state regulators want to tax that premium. And they want to tax, per member, per company. But the reason they're doing that is because they want they want to fund their public system. They want to fund kind of their state Medicare programs, and they're always looking for more revenue from that. And they look at the state of the current healthcare system, and the piece that they feel like they're missing out on is that self-funded, ERISA preempted premium that they want to get their hands on. And I think that's a primary driver of it.
Okay, awesome. With all the things going on in Washington, I mean, what are you, in the chaos that's coming with that, and the divide? I mean,
Yeah.
what's the biggest fallout in terms of that political environment and the impact it has on, the healthcare policies that we're seeing?
Yeah, I think, well, like I said before, I think that, the biggest issue is that I think people know that there are healthcare priorities that need to be taken care of, particularly around, that there's a drive for PBMs and drug pricing generally. And the fact that there's bipartisan agreement, but the fact that there's such a stalemate is preventing that from moving forward in a productive way. And I think drug pricing or sorry, like price transparency rather is a big part of that. So remember we passed the No Surprises Act a couple of years ago. There's all these preemption or there's all these issues around the implementation of price transparency. And it would be very easy for Congress to get some low hanging fruit and more efficiently do that. But the fact is that Congress can't even do low hanging fruit right now because they can't even pass post office bills. And I think we would be in a much better position as an industry when we're look through the No Surprises Act and the arbitration process and how what a mess it is for so many self-funded plans to go into arbitration with providers over ER and air ambulance claims. And there's easy solutions to this. And the fact is that the regulators nor Congress have enough gall, if you will, to actually pass or implement rules that make that more clear, that will help not only consumers but also providers and for that matter self-insured health plans. I think the good thing is that with the NSA that consumers are winning out of that, but it's putting us from a self-insured standpoint and providers in a really bad place. And it's fighting and it's figuring out a messy process, and there has to be a way to better implement an arbitration process that's one fair and it's not muddied up in the courts like the providers are doing for us right now. And the fact remains that there are so many arbitration claims, as a lot of people on I think the webinar realize. I mean, I think, Keith, I think that there's 4 times as many arbitration claims going on in the NSA right now than the federal departments ever thought would happen on an annual basis. And so it's a huge amount. And it's a system that's overwhelmed. It's a regulator that can't, that doesn't have a minute to stand on their feet and figure out what's going on. So it's been on it's kind of been left to us to figure out a messy process. And at the same time, the providers are just taking everything to court because they don't want a fair arbitration system. They want an arbitration system that favors them in terms of a higher reimbursement. And it's one of the issues of the cost of care, right? So.
In terms of compliance around all the NSA, I mean, I think we can all agree it's kind of muddy right now. But is compliance happening, or is it just people are dodging it however they can, or when it makes sense?
People are going through the process, and I think a lot of people on the webinar are probably doing that too. It's just a muddied process, and we don't have clarity on the guidelines around what, for instance, like an appropriate reimbursement rate means or is. And so people are going through this process. The arbitrators in many cases don't even know what's going on and don't actually know all the details of how they're coming to a decision. And remember this, at the end of the day, the agencies thought that there'd be 20, 30 different national arbiters to go through these claims. On any given day, I think there's like 7 or 8 certified federal arbiters, and they're handling it, and so not only do you have a very small amount of certified arbiters in the federal process, you have about 4 or 5 times as many claims as the agencies originally thought. So you have a system that's overbeared with fewer arbiters who are overwhelmed, who aren't coming to conclusions on arbitration claims in a timely manner. And so I think it's putting a lot of plans at disadvantage for a number of different reasons. So,
yeah. Any idea what it's costing the industry with?
Well, yeah, and that's I think always been one of our concerns is that, especially if you're a small health plan, you're bearing a ton of administrative cost on this. And so while you may save, for instance, on arbitration or, in terms of what you're paying for an ER bill, that's made up for by the fact that you have a huge administrative cost. You probably have a legal cost and a compliance cost. And so I think that's a great question, Heath, because at the end of the day, you're probably paying more to go through this entire compliance process than you're actually saving in a potential reimbursement cost, right? Yeah.
Yeah, I mean, we see it with some of
Yeah.
the NSA work we do, and we try to absorb as much as we can, but there's
Right.
certain filing fees that they're outside of even what we can
Absolutely. Well, and I think overall the industry is trying to kind of swallow the pill a little bit and try to put those costs internally. But the fact is that those increased compliance costs are going to end up on an already stressed out healthcare system that where premiums are rising, what, 6 7 per, I think I saw, what, 5.3% a year, right? Overall, I think on average premium. So a lot of these, some of these great legislative and policy ideas are meant to save money, but in fact they're increasing compliance costs, and then they're increasing policy premiums. And we need to do a job
I've got a way to
of
reduce
some of
that
those
trend
out.
though, if you want to
Right.
if you want to look at
Right.
reference rates. So
Yeah.
just
Well, and then I think the other issue,
innocent plug.
we talk about like things like Ozempic, right? Which I think is top of mind for like all these GLP-1s. And I think as these, and it's not just that, it's cell and gene therapy. And the fact is that they're making tremendous progress in a lot of these prescription drugs, and they're saving lives, and that's a great thing. I think that the next, well, it's not even the next big challenge, it's the challenge that's before all of us, is how plans absorb these costs, right? Because all of a sudden you have these cell and gene therapies that aren't just for one disease, they could be for multiple, and sometimes they, like look at Ozempic. I mean, it's meant for one thing, but all these people are taking it, and it's putting a cost strain on the system. And this issue, it's not an Ozempic issue, it's a future issue about all these different drugs and how we cover them and what the appropriate type of care is for them. But what's happening is that the Ozempics of the world then are putting a strain on the overall premium. That premium keeps going up. And going back, I guess, Heath, like circling back to like the ERISA debate, is the fact that these costs continue to go up, employer healthcare goes up, and then which always kind of begets the question of, well, what's the future of employer sponsored care, which is the bedrock of America's like private healthcare system. And that goes back to ERISA, and that goes back to an increasing concern in the House and Senate, even in the White House, about kind of what if at some point we get to a red line where employer sponsored care gets so expensive that we have a very serious conversation about a national healthcare plan. And then you get to kind of the underlying threat of what that means to ERISA and what that means to employer sponsored care. And it's a real threat. And I think people need to start taking that seriously, which is why I kind of double down on this idea that we need to, talk more about ERISA and self-funded care and what, like, how people are benefiting from that, versus kind of a national healthcare system. So,
And what if you think about those challenges? I mean, what is it that we as an industry can do that would help move this thing forward?
right. Well,
in a direction that we need it to move forward.
Yeah, it's a great point. I mean, I think, I think the best thing that folks can do is tell the story, and help. One, you need to be engaged. Two, you need to talk about the good things that are out there and employer sponsored, like on the self-insured side, and tell like the real life stories about how plans are helping people. If we don't talk about ERISA, if we don't talk about the benefits of that, we don't talk about employer sponsored care, we're going to lose this battle. And Heath, I think that's a great question because I think people get complacent, and complacency is a really bad thing when it comes to lobbying and advocacy, because complacency means that like you feel protected and you're not telling your story. And when you don't tell your story, other narratives happen, and you're left without a voice. And so all these other stories are going on in Congress about, well, expensive care and drug pricing. And if you don't put that voice forward, then you're losing out on, better, advocating for yourself. And it goes back to my point about your worst enemy is a politician who doesn't understand your story, because then they're going to make dumb decisions, and they make dumb decisions a lot. So, and I'll be honest, like, I was a lot of these staffers, and a lot of you probably, if you're on the Hill, like you meet them. I mean, these healthcare policy staffers are 24 years old. Like, they're just off their parents' plan. They don't know anything about healthcare. But that's why we need to do a better job of educating them, from our perspective versus them listening to other people. So,
yeah, I mean, there's obviously somebody with an agenda out there that is, feeding that information to those 24-year-olds and
right.
the guys on the Hill. What's their agenda? What are they, and who are they, and what are they trying to accomplish?
Well, I mean, so look at healthcare policy, right? So, I mean, there's a number of employer plans, but the other issue that we have going on, Heath, is that we're losing on a congressional level, because do you know how many healthcare industry folks are on the Hill? Like, so let's take a snapshot of Congress, right? All these members of Congress are coming from a background. Some of them are builders. Some of them, come from small business. Do you know who the biggest, one of the biggest caucuses on the Hill are members of Congress who are doctors, who are providers? And guess what? That doesn't help us out with. It doesn't help out when we have, when we come to them with self-insured and insurance issues, because all of a sudden, it's not like there's 5 or 10 or 15 Heaths in Congress. There's 85 doctors. And so when I go to key committees like Ways and Means, Energy, and Commerce, and I'm talking about things like we're talking about today, right? Drug pricing, price transparency. I'm not talking to people with an insurance background who understand employer care. I'm talking to 80 people who are providers and who want a high reimbursement rate. And that automatically puts us at a different footing than people who are kind of neutral. But I bring that up, and it's not because that it's important to have members of Congress who are providers who can bring that perspective, but a lot of them are not friendly to some of the cost saving and transparency items that we want to see happen. And it's things like like the gag clause. It's things like making sure that we have a realistic view of where prices are. They don't care about that because they want the highest reimbursement rate they possibly can, but that's driving up costs. Now, the funny juxtaposition about that, though, is that in a lot of ways, insurers and providers are on the same page, because providers don't want a national, health insurance plan either, because that would bring down the reimbursement costs. And so, we have like this semi-symbiotic relationship where it comes to like, let's play nice together, because if we go too far down this road, none of us are going to be happy about it. But I think, to your original question, Heath, that the fact that there are so many providers on the Hill is a challenge. And, not only from an advocacy perspective, but also from a, kind of the future of where policy is. So,
Phenomenal little piece of information. It's been hard for me to concentrate since you mentioned Heath in Congress, which got me thinking. I mean, you were suggesting I run for mayor of my little town. I mean, where do I start? Do I start there, mayor of Ridgefield, and then on to Congress?
I mean, you would be.
And will you be my campaign manager?
I would be your campaign manager. I think what I always love is like you talk to members of Congress about how they initially got into politics, and half of them, and folks won't be surprised, are like, they started off as like their homeowner association like president, or they started off, in their, little town championing a cause. But it's what gets people involved, and that's a good thing, right? And one of the things that always gets me about Congress too is like you have members of Congress, you're like, oh yeah, I'm really impressed, and then you also have an equal number of members of Congress where you're like, how the heck did you ever get elected? It's amazing, but it's, what I love about Congress, and what is great about our constitutional system, is that the House, for instance, is really a microcosm of 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 the US, and as dysfunctional as it is, there's a reason why our founders set that up. And I love talking to members of Congress because they're from such a diverse background. They come from, they're all of them have different reasons why they, why they came to the Hill. And so disagree or agree with them. I feel, they're trying to do the right thing. They started off, you'll always talk to some of them and you'll walk away wondering how their constituents ever voted them in office. So it's great. but
So
but at the end of the day,
I was vice president.
they're just like you and I. So
I was vice president of my senior class.
well, there you
and
go.
host
So
the
you have a
Fireside
start
Chat.
somewhere,
So
right?
there's
Yep.
huge resume, good potential. All right. Speaking of politics and elections, what's your crystal ball telling us about what we got coming up in November? What can we expect?
Yeah, I mean, I think you know Congress is not going to do much. I mean, we have some items that they have to deal with, like the foreign intelligence, FAA, REOF, things like that. Whether they have the bandwidth to do much, I don't know. We're going to have a huge end of year spending bill that's going to, I'll call it a Christmas tree bill. It's kind of going to wrap up everything. I go back and forth, Heath. I think the House is going to come down to 4 or 5 seats one way or another. It's already close. I mean, as of next week, the Republican majority is down to a single seat. And the important thing to remember there is because of the House rules, that any single member can move to kick out the speaker, right? And so like Kevin McCarthy, so Kevin and I worked together on Ways and Means. I've known Kevin for 20 years. And and what happened to him is still resonating. And I think there's internal battles on the Hill. Like I said, Speaker Johnson's kind of an unknown entity, but every single day that Johnson walks into his office, he's kind of walking on, he's walking on a very thin thread. And after the foreign aid bills passed this past week, I think when they come back into session in a week, we could very well see like a recall motion, which I don't think the American people really want to see because they've had enough. But why I bring that up is because that resonates then as we head into November. And, really, I think the House is going to be close. The Senate comes down to 5 or 7 seats. But the reason I think that's important to see is that I think the Senate and the presidency are going to surround the same 5 or 7 states. So I think where the Senate majority lies is exactly where we'll see, some of the presidential votes. One of the things that we always look at, I mean, people in Washington love polls, right? We love polls. We look at numbers, even if they're not always real. But President Biden's approval rating is hovering, like, I think south of 40% right now. And if you look historically at what that disapproval is and reelection, the last president with that kind of disapproval was Bush, the first Bush, and he lost reelection. And and so it'll be interesting how that dynamic plays out while we have Trump, who is in the middle of court battles. We obviously have there's, I think, a big fight on things like abortion, but those are resonating nationally, and those are going to have impacts as we head into November. And so I think, I'm dodging your question a little bit. I think
I got that sense.
I think if I put on my hat, I think the House goes Democrat. I think the Senate goes Republican. But when we when we
And
when we talk in
Joe V.
when
Don,
we
what
talk
happens
in
there?
mid-November, don't remember any of that. So
All right. What?
and
Okay.
I think
All
and I think the presidential is going to be within like a 2 or 3 point race, and it's going to be dependent on I think on some of those Senate seats too. So
is anyone talking to each other after the dust settles on this thing?
what do you mean?
I mean, will there? It just seems like everybody's so divided. I mean,
Right.
will there be collaboration after we get through all this?
Yeah, I mean, I
And
well,
what
okay,
impact does that have on
I
healthcare?
truly hope so. I mean, something has to change. I mean, uh, when I was on the Hill and I worked for the Speaker's office, I worked on Ways and Means, and I think I was always proud of the fact that I had friends across the aisle, and we tried to do the right thing, and we tried to work across the aisle and get good things done. I'm worried that that dynamic is finished now, and at some point we have to have a reset, right? I mean, the fact is, I don't even think the American people want to. I think people are sick. People are long sick of politics, and they're sick of a legislature who's not doing anything, and I think they expect change now. Part of me hopes, Heath, to your question, that the election will level set that a little bit and maybe normalize things. Now, will that happen? I don't know. Would I like that to happen? Yes. I think there's a lot of us in DC who are hoping that it's there's a legitimate reset in the environment here. I think there's a thirst and a need for that, and I think at the end of the day, the electorate's going to do that. I think one of the interesting things too, talking about the election, is that you have a couple parts of each party, right? You have your base, and you have your activists, right? And it's interesting because what I'll say is Trump doesn't have his base, Trump has his activists. And then you go to Biden, and Biden has his base, but he doesn't have his activists. And so it's like this dichotomy. And it's very interesting. And I think that's pushing some of the party dynamics and the fights we're having now. And it's a fight between what I'll call your traditional party bases versus your progressive activists, whether that's Democrat or Republican, and I think that's the real fight right now. It's kind of the fight isn't between Biden and Trump. The battle right now, I think, is between activists and the base, and where each party is going. And I say that too, Heath, because I think that then drives policy, right? Because at the end of the day, politics drives policy.
So, looking at the 4 years following the election, I mean, are there any major healthcare policies at risk, and what would those be that we should be thinking about?
Well, I mean, as I look, I mean, I'll put a couple buckets forward, right? And we've kind of talked about that. I mean, I think there's a real debate about the cost of prescription drugs, right? And every year that goes by, and you've seen this, Heath, right? Like we're just seeing increased pricing on these very specific drugs that are coming out that are driving up the cost of care. And there needs to be some realistic policy around what that means and how drug companies can set those policies. I think the main driver of what we're going to see in healthcare over the next couple of years, though, has to do with transparency. It has to do with the cost of care, why we're paying what we are for specific procedures, why we're paying providers what we are. And I think from a self-funded perspective, it's about data access, right? It's about making sure that we should own that data. It's ours. We need to ensure that we have access to that, and it's making sure that things like the gag clause prohibition continue and are strengthened. It's about drug pricing, and then again, I'll go back again to not to continue to beat the drum on it, but ERISA and just employer sponsored care. I think we we need to be very careful about what has largely been apathy around how we tell our story and why this is important. Because the fact is, if we continue to have that apathy and we're not telling that story, the entire future of employer-based care is at risk, whether that's fully funded or self-insured. There's an issue there, and I've never been more worried about that than I am right now. I mean, the fact that there was an ERISA hearing, that we have, that we're in the 50th anniversary of ERISA, and we have a great story to tell that's not been told, I think is a challenge, and it's one I'll tell all of you that we need to do a better job of. So.
So there's a couple of ERISA questions that have come in the Q&A. And for
Okay.
everybody else on the line, feel free to add questions to this that are coming to mind on that Q&A button. But I'm going to read them in reverse order. I think that
Okay.
probably makes the most sense here. But one just came in. Ryan, I was pretty surprised by some of this webinar and had not heard of the significant scrutiny that ERISA on Capitol Hill. Do you really think the significant reform here is realistic compared to something like the PBM reform that has showed strong signs of bipartisan support?
Well, so if you asked me that question earlier this year, I would have said that we would have already seen PBM reform, and I think we will. And I'll be honest, like pharma, I don't think, we have a huge drug pricing issue. I think the PBM, pointing the blame at PBMs is low hanging fruit. I also feel very strongly that even if we do PBM reform, that it's not going to help drug pricing. But when you're pharma and you spend $20 million a year on lobbying, you can point the finger about you can point a hard finger about whoever you want to, and their fingers pointed to PBMs. Do I think it's going to solve the problem? No. Do I think Congress is going to pass PBM reform? Well, yes, but Congress can't shake hands with each other right now. So, I think we will get PBM reform. But I think to that larger question, it's not that Congress is going after ERISA, but there's criticism of it. And I think what I'll warn people is it's not a battle against ERISA. It's an erosion of it. I think what we need to be careful of is a slow erosion, right? So we're like, oh, okay, well, that's not great, but we can deal with it. That's not great, but we can deal with it. Well, at some point, that drip becomes a waterfall, and that waterfall then becomes an issue. And what I'll warn folks about is that you may not see a huge ERISA battle right now, but be aware that of that drip of erosion over time. So like 5 or 6 years from now, one thing after another all of a sudden leads to something much larger. And I don't want the industry 5 or 10 years from now waking up one morning and being, wow, I can't believe that all these little things happened over the past 10 years that makes us concerned about the future of our industry. So
Yeah, makes sense. Okay, another question from Katie Peterson. How much money is estimated to be available if ERISA preemption goes away? What regulators think this is worth?
Well, I mean, it's not about the money available. It's this idea that a nationwide, like a public health insurance marketplace will be cheaper for individuals, consumers. I mean, and think about it. I mean, one of the concerns is that as employers see, a 3 to 5% increase year over year on healthcare spend, you even have C-suite executives and HR say, well, is this worth it for us? And I think that's concerning. And then you're in Congress and you kind of look at Medicare for all, and look at what's kind of being spent in the private marketplace versus what it would cost in the totality of like a public healthcare system. And I don't have those numbers off the top of my head, but I think that there's growing support in certain corners of the hill for that public marketplace versus an employer, sponsored place that we sit today. Will it save money? Maybe not. Will it drive up, taxes? Yes. Will it improve care? My only answer to that is you have to look at Canada and overseas to kind of see where their public healthcare system's at.
I mean, wouldn't Obamacare kind of be a canary in the coal mine in terms of, that was supposed to save money, right? I think we can all agree
Right, but
that's had
I think the
some
question is,
impact.
has it? And more than that, Heath, it's about the efficiency of the system, right? And I think that's one of the big questions is that, system efficiency, being able to see a doctor, and then obviously like the overall cost, and who's gonna bear that, right? Because right now that cost is on employers largely. I mean, individuals, we're all paying premiums, but a lot of that's coming from employers. And so like, what if you freed up that money? What if it went to the federal government to do a public healthcare system? And that's a whole nother, funding debate. So
Campaign spending, we could put that towards it.
I mean, you could put the $15.2 billion in TV ads, and probably fund a pretty good plan. I'm assuming so.
Okay. You've hit on, drug pricing quite a bit. Anything more we want to talk about there in terms of policymakers and the direction things are going in?
No, I mean, the last thing I'll say on that, I think that there's a real bipartisan focus on drug pricing. Do I think it's the right I'll say this just personally. I think that I said they're going after PBMs. Is that going to solve the problem? No. I think that there probably needs to be more focus on some of the drug companies and the manufacturers themselves. And we need to stop throwing a dart at the board and saying, well, hey, this drug is going to cost $15 million or, 12 or whatever it is. There's no rhyme or reason for some of the costs that are out there. And we need to have a realistic view of the efficiency of drugs, but also, why that all of a sudden like self-insured plans are paying, $3, $5, $10 million for some of these drugs, having no idea of the efficacy. Right. And there's a very real conversation going on the Hill about having almost like a federal reinsurance pool for some of these drugs, so that if you pay $10 million out of the plan for an orphan drug or something like that, that 10 years down the line, Heath, that we want to know that kid or that adult was actually cured of that disease, versus having a pill that we actually don't know the efficacy of, and that we're putting $3-5 million forward just hoping that it works. And I think the question then there is, well, what's the role of private insurance versus versus the federal government? But then you slowly get down the line of, well, if the federal government starts reinsuring drugs, well, is that a slow walk towards a larger federal healthcare system? So it's a slippery slope, right?
A slippery slope.
Yep.
Okay. Any other things you want to add to this discussion before we start heading in the wrap up mode here?
I'm done for right now, Heath.
All right. So, I mean, I'm guessing a lot of people have already heard this, but I'll make it public and want to congratulate you on your promotion and new job. You're now the president and CEO of Surety and Fidelity Association of America. So that's a lot harder to say than SIA. Is there an acronym
Right.
that gets used there, or how's that work?
Yeah, no, it's a different industry. I think, one of the things I've found is that, we have a lot of the same members, just in a different kind of line of business. A lot of our our members at SFAA, you know, have stop loss programs, and they have surety programs. But what I'm doing now is just kind of a different form of insurance. Our members write about $8 billion in premium a year, and my new focus now is kind of on you know, transportation projects and protecting, you know, at the end of the day, surety and fidelity bonds protect taxpayers and make sure that that programs are running well. So, you know, from an infrastructure standpoint, from a contractor standpoint. So a little different than the healthcare space, but I'll definitely miss it.
Are your national conferences held at the Marriott's and Arizona's and all
No,
the?
it's funny.
You
I
can
have
change that up a little bit.
so my annual meeting is next week, and my first board meeting. I've been on board about 4 weeks now. So yep. So my new test, Heath, it will be next week, but it's right here in DC, so I don't have to go
See what the
far.
crowd's see
Right.
what the crowd's like.
Yeah.
I'm sure you'll do a great job. I know that and I can speak for myself, but I know many others in the industry have really enjoyed what you brought to the self-funded industry. And you know, me personally, been a good friend of mine for a long time. I'm gonna have to find a new opening speaker for our conference, I guess. But maybe you can come back and teach us all
Maybe
about
I'll come back.
surety
No,
and
but it's,
fidelity. Yeah.
you know, I've you know, I work for you know, I've spent almost a decade in the self-insured world, and I love it. I wasn't looking to leave. It's been, you know, I still have a love of it. I still follow it closely. I'm looking forward to, you know, you know, getting to know kind of a new industry, but I'll definitely miss, you know, a lot of you and conferences, but hopefully I can, you know, see a lot of you again. So of
Very good. Well, thank you for being on this one today.
course.
Wait, oh, Vic just wrote in, congrats, Ryan, on your new role. We're excited. We'll miss you. There you go. There's another good one in this industry right there. So, and I know Joe, I think hopefully you got his contact information. It's on the screen right now. So our work at surety.org.
That's it.
Okay, well, this wraps up, pretty close to wrapping up our April Fireside Chat. Coming next month, what do we got, Lindsay? Yep, there we go. Shannon Roselle at Newport Healthcare. So I just interviewed with her yesterday, and I think this is gonna be a good one. It's gonna be around mental health and the things going on there. So join us for that one, May 15th, 11 a.m. Pacific. For those of you that think you may have missed the original email that went out about advertising for Ryan's, you did not miss it. We forgot to send it. It was sitting in the outbox. So for the, you know, 50 or so of you that made it today, thank you very much. And keep your eyes open for that next one. So thank you guys. We're going to get off a little bit early today. Ryan, go ahead and get back to working on that board slide. Thank you much, guys. Take care.
Hey,
See you next month, everybody.
thanks for having me, Heath. Appreciate it.
Yep.